The nutrient gaining the most traction among scientists studying SARS coronavirus 2 is vitamin D. The vitamin is found in some foods. It's also a hormone our bodies make when ultraviolet rays from sunlight strike the skin. Its most critical role is in immune function, which is why it's in the spotlight with the coronavirus. This correlation has prompted scientists to further explore whether vitamin D has any protective qualities against SARS coronavirus 2. In this video, we will look at research regarding vitamin deficiencies and what they mean in terms of COVID-19 transmission and risk. In a cohort study of 49 patients who had a vitamin D level measured in the year before COVID-19 testing, the relative risk of testing positive for COVID-19 was 1.77 times greater for patients with likely deficient vitamin D status compared with patients with likely sufficient vitamin D status. The difference is statistically significant. Calcifediol is a pre-hormone that is produced in the liver by hydroxylation of vitamin D3. Physicians worldwide measure this metabolite to determine a patient's vitamin D status. Low levels of calcifediol was associated with higher mortality among ICU patients and with development of acute respiratory distress syndrome. Vitamin D deficiency and treatment changes were combined to categorize the most recent vitamin D status before COVID-19 testing as likely deficient, likely sufficient, and two groups of uncertain deficiency. Vitamin D status before COVID-19 testing was categorized as likely deficient for 25%, likely sufficient for 59%, and uncertain for 16%. Overall, 71 participants, or 15%, tested positive for COVID-19. In multivariate analysis, testing positive for COVID-19 was associated with deficient vitamin D status compared with likely sufficient vitamin D status. Predicted COVID-19 rates in the deficient group were 21.6% versus 12.2% in the sufficient group. In Italy, it is generally considered one of the European countries with the highest levels of calcifediol deficiency, particularly in the winter. COVID-19 mortality rates have been particularly high in the country, but decline in the summer months when vitamin D deficiency is lower. This leans towards a potential direct relationship with vitamin D deficiency and COVID-19 mortality rates. If vitamin D does reduce COVID-19 incidence, it is tempting to consider whether it might reduce COVID-19 transmission. Vitamin D strengthens innate immunity, so it might be expected to decrease COVID-19 infection and transmission. Vitamin D also affects metabolism of zinc, which decreases replication of coronaviruses. However, caution is required because of the potential importance of asymptomatic persons in COVID-19 spread. Vitamin D modulates immune function through effects on dendritic cells and T cells, which may promote viral clearance and reduce inflammatory responses that produce symptoms. Higher vitamin D levels correlate with lower interleukin-6 levels, which are a major target for controlling cytokine storms in COVID-19. To the extent that it prevents infection, decreases viral replication, or accelerates viral clearance, vitamin D treatment might reduce spread. On the other hand, if vitamin D reduces inflammation, it might increase asymptomatic carriage and decrease symptomatic presentations, including cough, making it hard to predict its effect on viral spread. The low cost of vitamin D and its general safety, at least at doses of up to 4,000 IU per day, nevertheless support arguments for population-level supplementation, perhaps for targeting groups at high risk for vitamin D deficiency and/or COVID-19. Testing of vitamin D levels may be an important tool in guiding treatments, and the availability of low-cost home testing for vitamin D may be valuable given the benefits of social distancing in COVID-19. The National Institutes of Health say most people meet at least some of their vitamin D needs through exposure to sunlight. Stay-at-home orders and lockdowns brought on by the coronavirus outbreak have made access to frequent sunlight harder for some people in recent months, leading many to almost certainly have lower vitamin D levels than in normal conditions. If wishing for supplements, remember to talk to your doctor if you are taking any others. We hope you all stay safe. Thank you.